Hello, my name is Jacob Renone, and today I'm going to be demonstrating how to give a subcutaneous injection. So upon walking into my patient's room, I'm going to introduce myself and compare their wristband to the information that I have on the MAR, asking my patient identifiers to ensure that I have the right patient. And then I'm going to, before that, I'm actually going to look at the medication order. My printer is broken, unfortunately, so I just have it on here. The order is for heparin, 5,000 units subcutaneous, and our supply is 5,000 units per 1 milliliter vial. So I'm going to be drawing up 1 milliliter of medication. To choose my injection site, I'm going to assess the weight and build of the patient. For a normal-sized adult, I will be choosing the abdomen area. So underneath the costal margins to above the iliac crest would be an appropriate place to give the injection. So now I can pull up my medication. So I'm going to take the top off of this and I'm going to cleanse it with an alcohol swab, scrubbing it for 15 seconds. I won't do a full 15 seconds just for the video. And then to get my supplies ready, I'm going to take my syringe out. This end right here is sterile, so I'm going to be careful not to touch it. Open up my blunt needle, this end is sterile as well. And then the two can just attach like that. And then I'm ready to draw up my medication. So I'm going to pull back to the amount of medication that I'm looking for is 1 milliliter. So I'm going to inject 1 milliliter of air. And then I can get to drawing up my medication. Making sure not to get any air bubbles in. Perfect. And I'm just lining up the bottom of the rubber stopper to the line that I'm looking for. So 1 milliliter, the 1 milliliter line. So now I can take this, my blunt needle, dispose of it in my sharps container, and I will be using a 25 gauge needle, 5/8 inch, and that is appropriate for the build of my patient. So I can attach it just like this. My patient here. So I'm going to cleanse the site. For 30 seconds this time. Perfect. And so if I'm able to grab 5 centimeters of tissue, then I can inject the needle at a 90-degree angle. And if I'm able to grab 2.5 centimeters of tissue, then I'm going to inject it at a 45-degree angle. So after cleansing the site and explaining to the patient the procedure, I'm ready to uncap my needle, pinch the skin, hold my syringe like a dart, and 90-degree angle straight in, administer my medication, and take the needle out. I can then recap my needle and dispose of the whole syringe in the sharps container. Afterwards, I would not rub or massage the site because that will interfere with medication distribution and absorption. I'm now going to show how to give an intramuscular injection. So the first couple steps are the same. I'm going to check the medication order from the physician, and then I'm going to go into the patient's room, introduce myself, and look at their wristband, compare it to the MAR to ensure that I have the right patient, asking my patient identifiers. And then after that, I'm going to assess the patient, so their weight and their build, to determine an appropriate injection spot. And today I'm going to be doing the vastus lateralis on the thigh. And the way to find that is one hand just above the knee, and then one hand placed just below the greater trochanter of the femur. And then that space in there, you want to use the middle third of the muscle. And I will be using today a 23 gauge needle, which is appropriate for aqueous solutions, and it is 1 inch long, which is appropriate to be injected into the vastus lateralis of a normal weight adult. So my medication order here, I have Haldol 1 milligram intramuscular, and our supply is Haldol 4 milligrams per 2 milliliter vial. So that means that I will be needing 0.5 milliliters of medication. So I'm going to start by prepping my syringe with my blunt tip needle. Same way as last time, I'm just going to open my syringe. This end is sterile, so I'm going to ensure to not touch it. Open up my blunt tip needle like a banana peel, and these two pieces can attach together just like that. And then for my ampule here, I'm going to ensure that all the medication is in the bottom. I'm going to take a piece of gauze, wrap it around, and break the ampule away from me. Just like that, perfect. Now I can draw up my medication. And so I don't have to inject air into this one because it is an open system. There is no top on it. So I'm just going to be careful not to touch the sides. And I'll drop 0.5 milliliters. Just like that. Ensuring that there are no air bubbles. There's a big one in there right now. There we go. And again, I'm just lining up the bottom of the rubber ring of the stopper, or not the bottom of the rubber ring, but the rubber ring of the stopper to the 0.5 milliliter line. So now that I have this can go in my sharps container, as well as the top of it. I should have put that in there earlier. And now I can take my blunt needle off, put it in my sharps container, and I can open up the needle that I will be giving the injection with, which is the 23 gauge. Perfect. So now I can explain to my patient the procedure, what I'll be doing, and then I can cleanse the injection site with an alcohol swab. Again, I'm going to be doing it for 30 seconds. I won't do a full 30 seconds just for the video. And for an intramuscular injection, instead of pinching the skin, I'm actually going to pull the skin apart. So I'm going to pull the skin taut, and then I'm going to administer it at a 90-degree angle. So I'm just pulling the skin taut, administer it at a 90-degree angle, holding it like a dart. Then I can administer my medication. And then I'm just going to put a cotton ball on the injection site when I take it out, just in case there's any bleeding. And then I can put a Band-Aid on it. I'll recap my needle, and the whole syringe can go in the sharps container.